Good afternoon, everybody. I am Dr. Sumit Banerjee, working as a consultant ophthalmologist for the last 25 years. Today, I will be discussing about problems of diabetes in ophthalmology. But before doing that, let me discuss some of the points which causes some of the diseases which causes blindness, common causes of blindness, 5 common causes I will be discussing today. Before doing that, let me discuss about the gravity of blindness globally. We have about 285 million visually impaired people globally, of which about 39 people are legally blind. And above all, it has to be mentioned that about 1/3 of the blindness reside in India. That is, every 1 out of 3 blind person they live in India. So let me discuss about the common causes which are producing the blindness in the community. They are as such refractive error, cataract, glaucoma, age-related macular degeneration, and diabetes. And from the statistics, it is evident that diabetes is one of the main causes of blindness in the society, not only in India but it also globally. So let me discuss about the incidence of diabetic retinopathy. As of most of the people know that diabetes are of two types, type 1 and type 2. Type 1 means this is insulin dependent diabetes, and this usually starts in the early age. And type 2 is the second type, the age onset. What we say age onset because it starts little late in the adult life. And diabetic retinopathy can affect both these types of diabetic patient, but the incidence is more in type 1, that is insulin dependent diabetic patient, than the type 2 diabetic patient. And it has been seen that after 20 years of diabetes, a person with diabetes, type 1 diabetes will suffer, 80% of those will suffer from diabetic retinopathy in comparison to 60% in patients with type 2 diabetes. So the incidence of diabetic retinopathy depends on the duration of diabetes, not only duration but also the glycemic control of the patient. It depends how far the retina will be affected. And let me now tell you what are the symptoms. Basically, diabetic retinopathy initially are asymptomatic. That means it does not produce any symptom initially, but it can be seen by an examining ophthalmologist. And later on, it can produce multiple variant of symptoms like vision failure, night vision failure, color defective. So it is very important, as because it starts asymptomatic, it's very important for the prevention of diabetic retinopathy to identify it as early as possible. So how can you identify diabetic retinopathy? Usually we ask the patient with diabetes to meet the consultant ophthalmologist in case of type 2 diabetes 5 years after the onset of diabetes, and in case of type 1, that is insulin dependent diabetes, just immediately after the diagnosis of diabetes. So not only the sugar control which is important, but also as I also said, the other profile, chemical profile of the blood, that means lipid profile, hemoglobin, kidney function is all important to prevention of diabetic retinopathy. Now I will concisely going through the treatment of diabetic retinopathy. As said, usually, as already I have told you, that diabetic retinopathy, if is diagnosed early, is very easy to treat. As because the patient is not asymptomatic, the patient comes very late, and then the treatment becomes difficult. Nowadays, so many procedures are available, starting from laser and anti-VEGF. Now they have started anti-VEGF injection are given almost frequently to a diabetic patient with retinopathy. And last of all, vitrectomy and other surgical procedure. So most important, come early, diagnose early, and irregular follow-up. Regarding the follow-up, what is the schedule of follow-up should be? It should be done every 1 yearly in early diabetic retinopathy. And if the diabetes is advanced, then it has to be checked up every 3 or 4 months. With a special precaution, I would like to mention for the pregnant patient, the patient who are pregnant with diabetes, they must consult the ophthalmologist frequently because pregnancy enhances the diabetic retinopathy. So stay safe and stay healthy with diabetes, but be cautious and maintain your blood sugar and consult your physician and ophthalmologist regularly to detect early diabetic retinopathy.